everybody. Thank you for joining us this morning for SAEM webinar series on how to write a winning abstract. My name is Nick Mohr, and I'm from the University of Iowa College of Medicine. I'm a professor of emergency medicine and anesthesia critical care and the co-chair of the scientific subcommittee of the SAEM program committee. I'm going to be talking this morning about how to write a winning abstract along with my co-chair, Dr. Colin Greineder.
Thanks, Nick. My name is Colin Greineder, and I'm an assistant professor of emergency medicine at the University of Michigan. Nick, you and I have had the pleasure of scoring abstracts together for a couple of years now, and we consistently see these abstracts getting stronger and stronger every year. So our goal for the next little bit is for us to give you some tips and insights so that you can know what the program committee and SAM are looking for in a winning abstract. During the first part of the talk, Nick and I are going to go over the sections of an abstract and our review criteria, and then I'm going to go over some examples of pitfalls and tips as to how you can make your abstract really stand out.
Thanks, Colin. I really agree that the abstracts keep getting stronger every year. This morning, we're going to talk about the abstract submission and the scoring process. We'll talk a little bit about some common pitfalls that we see in abstract submissions. And then we're going to talk about how you can get your abstract submitted and accepted to present at SAEM 2022. There are several goals of scientific presentations. We know that people submit their abstracts to meetings so that they can advance the science, but we also know that you submit your abstracts so that you can attend the meeting, to develop collaborations, and maybe to participate in career development activities. That's why it's so important that as you're preparing your abstract for presentation, that it's as strong as it can be, both for review and when you give your presentation. There are several keys to having a high-scoring abstract at SAEM. The first important key is to do important and impactful science. Consistently, we see that the best abstracts report the best science. The second key is really to report it clearly. And then the third is to be doing work that consistently pushes the boundaries to improve emergency care. All of those principles require planning, preparation, and time. And the strongest abstracts are the abstracts that come from research teams that start thinking very carefully about their science long before the abstract is written or submitted to SAEM. The SAEM abstract submission portal is open right now. It opened on November 1st and we'll be accepting abstracts until January 4th. I would really encourage you to start writing your abstract now if you haven't already. Don't wait until January 3rd because the very end, there's a lot of activity. And the earlier you get started, the more opportunities you and your research team will have to revise your abstract and make it stronger prior to submission. So what happens after you submit your abstract to SAEM? The first step is to submit your abstract through Cadmium, which is the software that we use for managing all of the abstract submissions. We have a lot of abstract submissions each year, more abstracts than we can accept for presentation at the annual meeting. After your abstract comes in, the program committee and other experts throughout SAEM will score your abstract. Each abstract will have 2 independent scorers. Each of those scorers have experience doing research, but they may not be a content expert in your area of science. So it's really important as you're writing your abstract that you write it for an audience of intelligent non-experts in your area of science, which is reflective of those who are going to read your abstract as well. The third step is abstract selection. That's based on the scores that your abstract receives from those 2 independent scorers. Selection is what determines who presents at the annual meeting, who is giving oral presentations versus lightning oral presentations or other presentations. And then finally, you'll be notified of those decisions. Abstracts at SAEM have a very structured format. All scientific abstracts have 4 subsections: the background, the methods, the results, and the conclusion. I'm going to talk in the next few minutes about what goes into each of those sections of an abstract. Abstracts are limited by word count. We have a character count. Actually, it's 2,050 characters, not including spaces or headings. So before you submit your abstract on Cadmium, you probably want to write it in Word and check your character counts so that you can revise it before you're pasting it into the dialog boxes within Cadmium. All abstracts are submitted in the online portal, and at SAEM, we do not accept tables or figures as part of your abstract. I told you that there are 4 sections that are part of each abstract. The first section is the background. The background is typically one of the shortest parts of the abstract, and it really just justifies the importance of your research question. You want to be really concise in this section, and you really just want to convince the reviewers and your readers that your study needs to be done. The last sentence of your background will be your objective statement or your hypothesis. The second section is your methods. In your methods section, you want to be very specific about what it is that you did. This is the meat of how you're going to convince reviewers and your readers that you are doing high quality science and that your methods are sound. You also want to be really clear about what statistical methods you used and how your analysis was conducted. The third section of your abstract is your results. Typically, that's the longest section of your abstract. This is the meat and potatoes. This is what people come to SAEM to see and what they'll be reading your abstract for. You want to relay clearly your tests of statistical significance. And usually you'll do that by reporting an effect size, like an odds ratio or a relative risk, or a difference in groups, along with 95% confidence intervals by convention. You also want to think very carefully about what the conclusion of your abstract is so that you can use your results to build toward that conclusion and convince your audience that the results of your science aren't a result of bias, but rather are a result of the intervention that you're studying itself or the risk factor. Finally is your conclusion. Your conclusion is typically another short part of your abstract. We want to see, and your reviewers will want to see, that your conclusion is tied directly to your objective. Remember, your objective is the last sentence of your background, and your conclusion is the first sentence of your conclusion section. We want to be very careful when we write abstracts that we're not overstating or understating the certainty of your conclusion, the impact of your findings, or the importance of what you've done, because this is one of the ways that we convey to our readers how the scientific community should use our findings to advance the science of emergency care research. You may also consider including some comments about future directions for your group or those who are studying your science. SAEM is a little bit unique because we publish publicly the review criteria. And that's a really important piece, I think, of writing your abstract, to review those review criteria. If you go to the SAEM website under the abstract submission page, you'll see abstract grading rubric down near the bottom. That abstract grading rubric or abstract scoring rubric is a way that we guide our reviewers to have reproducible evaluations of the science that comes in. It's also our way of telling prospective abstract submitters what we think is important in reporting science in emergency care research. In the next few slides, I'm going to go through each of the sections of the scoring rubric in a little bit of detail, because I think that in many cases you can score your own abstract and you can get a really good idea of what is likely to be accepted to SAEM and how you can maximize the chances that your science will be presented at our annual meeting. We have several scored abstract elements in 9 categories. There's a maximum score of 17 points that any abstract can receive. And obviously the higher scoring abstracts are more likely to be accepted and accepted for oral presentations or plenary presentations. There are specific guidance elements within each of these categories for evaluating different types of research. And we changed this about, I guess it was for last year's meeting, to really recognize that there are certain areas of emergency care research that are different. Medical education research, basic science research, clinical research, qualitative research. And we wanted to really make sure that all of those areas of science were being evaluated using a similar rubric, but discipline-specific metrics. The first section of the evaluation is the clarity of the objectives. The clarity of objectives is really just evaluating that objectives statement that I told you is typically the last sentence of the background section. It can be really helpful to use signposting in this section. We say that scientific abstracts are more math and less creative writing. So you might start this section with the objective of our study was to, or the hypothesis that we were testing was, and fill in that blank. Full credit is reserved for those who have clear, well thought out objectives that clearly come from the background information. You've built the argument that the question needs to be answered, and then you've told us very clearly and very succinctly what your question was. The second section is the appropriateness of the methods. The methods can be one of the more challenging elements to write. And one of the reasons for that is because you want to use the methods to really articulate how you're going to test the hypothesis or the objective that you already laid out. In some cases, the methods may not be completely appropriate. It may be something that's easy to do, but it's not the best technique to test the hypothesis that you have. And that's really what we're evaluating abstracts against. It's really important that the methods are clear. In some cases, they can be not completely clear, where a reader reads it and says, you know, I understand what hypothesis they're trying to test, but I don't really understand how they did that analysis. And that's a problem. This is a parameter that could be scored even before the study's done, because it's not just how you write it, although that contributes to your score here. It's also how well a study is conducted. As you're designing your studies, think about what the best available technique would be to answer your study question or to satisfy your objective. The third section is the outcome. This is another parameter that could be scored before a study's done, because you're going to select your outcome as part of your study design, typically before you even collect your data. And if your outcome comes directly from your methods and is tied very, very tightly with your objective, that's the type of outcome that would be scored well on this parameter. The fourth section is your data analysis. The data analysis used to be a section called statistics. And we've broadened that a little bit so that we can include different elements for quantitative versus qualitative studies. You can see the scoring criteria on the slide here. It's publicly available on the SAEM website. But what we're really looking for here as part of the analysis is that there is a clear analytic plan that's clearly reported and clearly articulates that the author has considered statistical variation or random variation in their quantitative analyses. Similarly, for a qualitative study, we're looking for high quality methods that clearly articulate systematic data collection, systematic analyses using qualitative methods that are robust. Generalizability. This is a section that used to be called scope. And generalizability is really the ability to use the results of this study to infer what the truth in the universe might be. So we used to talk about this in the context of clinical trials or observational studies, but we have broadened that to include specific subsections for basic science, medical education, or non-clinical studies. And the idea here is that the most generalizable studies are the studies that you and we would have high confidence apply even outside emergency medicine to some broader truth about education or about clinical care. Large multi-centered studies clearly are going to be viewed as being generalizable. Very small single center studies will struggle in getting a good score on the generalizability metric. The sixth section is relevance and importance. Relevance and importance was also expanded from the previous scoring criteria. And the reason for that is because it's really important, I think, that we identify science that is completely relevant to clinical care. That's not just emergency medicine. So the abstracts that score the best on this metric are those that speak to some greater truth to medicine in general, although those topics that apply very tightly to emergency medicine practice are clearly going to be scored well as well. The seventh metric is innovation. This is maybe a harder one to sort of think about your own study, especially before you get started. But what we're really looking for is studies that use some kind of innovative or novel approach to answer a question. Sometimes we ask why a study hasn't been conducted before, or why a question hasn't been answered before. And sometimes the answer to that is that it just hasn't. But in many cases, it takes some innovation or it takes some creativity to answer a question that hasn't been answered before, because the reason it hasn't been answered is because the innovation that was required to cross-pollinate between disciplines, for instance, or to use a new technique, or to compile a large enough network to be able to answer a question in a robust way, really just hasn't been performed yet. We also divide the innovation subsection into several different categories based on the science that's being presented. Classically, we've talked about clinical studies, but we have specific criteria for non-clinical studies, medical education studies, basic science studies, or even survey-based methodology. Studies can be innovative if they break new ground, even if they don't have immediate impact on the clinical practice of emergency medicine. But we still are scoring that innovation metric for all of the studies that are submitted to SAEM. The last, or the eighth criteria here is the quality of writing. I think that probably many of you know what this means. An abstract that is clear, succinct, doesn't have a lot of extra unnecessary words, that doesn't have misspellings, that reports results clearly in a publication-ready format are those that are going to be scored well on this metric. This is the only criteria that's on a 1-point scale instead of on a 2-point scale. And then finally is the strength of conclusions. The conclusion should be tied directly to the objective. If you start your abstract by saying the objective of this study is to, and then you clearly articulate the reason that you did the study, then the conclusion is going to be something directly tied to that. We conclude that, and then you're going to fill in something that speaks directly to that objective. A number of abstracts are submitted where an objective is vague or unclear, or is clear but is not tied to the primary conclusion. And those abstracts stick out because it makes the reporting unclear whether the study that was conducted is the study that was intended. One of the things that will be evaluated is how tightly the conclusion ties to the objective. So in conclusion, strong abstracts report the results of strong studies. Mentorship is really important, and mentors can provide examples for you or can read your abstracts and provide some critical feedback. And finally, drafting an abstract is a lot like telling a story. You're going to walk a reader through from the time that you thought of conducting this study, through conducting the study and interpreting the results, how your science changes emergency care science or practice. Now I'm going to turn it over to Dr. Greineder to talk about some common pitfalls and some tips that you can use to make your abstract submissions stronger.
All right, thanks, Nick. Yeah, I mean, I think Nick has already given you the keys to the castle here. I think it is remarkable that we publish our scoring rubric, and those of you who are on the call who are watching this webinar are already a step ahead because you're hearing how we score it. And you can tailor your abstract to that. One of the things that often comes up is a title. How do you choose a good title for your abstract? I think at SAM, we think that the best titles are the ones that report a major conclusion or the major conclusion from your body of research. We don't get too many of those, interestingly. If you look at the titles that we get submitted every year, most of them are a description of what was studied and perhaps how. So to give you a Nick, if you could just advance it, to give you an example of some good titles. I just, these are some that I have somewhat paraphrased, but these are from past years of really strong abstracts. So you can see the first one I really like: no prevalence of meningitis in febrile infants less than 60 days with a positive UA. This tells you what they did, and it tells you what their major conclusion was, all in one. I think that's, really a high quality title. And I think that as people are scanning through their abstracts, and trying to decide what they're going to attend, that's going to stick out because they, if you're interested in that, then you're going to go to see that talk. Other ones here you'll see are more in the second category, describing what was done. The second one is a trial comparing balanced crystalloids and saline. The third one is a cluster randomized trial. So they're very explicit about what they did and what they were looking at. I think weaker titles, the first one I have listed here, to tap or not to tap, that is the question. I think this is the type of title we often get for our didactic submissions, plays on words, idioms, that kind of thing. And I think that's more attractive for didactics than it is for abstracts. I think you're better off sticking to a conclusion that you had, a major finding that you had from your study. And the last one I think is important to highlight because you see choice of fluid for resuscitation and DKA doesn't really give you much information. It's somewhat vague. There's no, there's no report of what was found, and it's not even clear exactly what was done there. So I think you want to stay away from that if possible. All right, so background. I think this is by far one of the most common pitfalls that we see. And I have great personal experience with this. Some of you may know that I'm a basic scientist, and I've actually included one of my old abstracts here. This is an abstract from about 7 or 8 years ago. And I think you can immediately see what's wrong with this background. It's about 200 words. And, Nick went over the character limit that we have. The problem with including 200 words of abstract is that you won't have room for your findings or your objective. And if you noticed here, actually, I sort of put the last sentence, to this end, we have done this or that. It doesn't state our objective in this study was, and that's really important to do. Don't be vague about that. Use signposting, as Nick mentioned. State what your objective is. Don't paraphrase. And I think another thing that, and by the way, this abstract was rejected, no surprise. I'll actually have a second one here, which is a more recent abstract. Again, it's somewhat, I'm a basic scientist. What I do is not necessarily going to be immediately relevant to the clinical practice of emergency medicine. And we know that we have intelligent, skilled reviewers who are familiar with research studies and methodology in general, but they're not content experts. And yet you can take that background and squeeze it down into a much smaller version, and you'll have a much better chance of getting accepted. One last thing that I'll mention about the background is something that our program committee chair, Darren Beam, likes to say, which is that don't mistake the background as your opportunity to convey your passion for the subject. You will have the opportunity to do that when you're standing next to your poster or when you're giving your oral presentation. You don't need to put that in your abstract. Okay. All right, methods. Well, there's just so much to say about the pitfalls and methods, but I'm going to highlight retrospective chart review because it is a huge part of what we do, and it's a large portion of the abstracts that we get across disciplines, right? Observational studies, medical education, a lot of things require retrospective chart review. So I'm just going to go through, I've made up an abstract here. This is not a real abstract. It has no relevance to anyone's abstract, but I wanted to point out a few things that we see coming up over and over again, especially this first one. More and more studies are relying on query of the electronic medical record, of course, right? But you have to be clear about how that was done, right? So this study here, PE cases were identified by query of the electronic medical record, but they don't provide any information about what that means. Was it done by ICD-10 codes? Was it done by this diagnosis table? What kind of validation was done to verify that query is actually, identifying the correct cases or not. This could be anything, from as simple as an ICD-10 code to some sort of machine learning based natural language processing algorithm that they're using to identify these cases. So that's really important. Likewise, if this next thing here, we calculated the PESI score. This was clearly done by manual chart abstraction. So remember your guidelines for methodology for manual chart abstraction. You should specify who did the abstraction. Were those people trained at all? Were they blinded to the study hypothesis? Did they, was there any effort made to see that the data that they abstracted was correct? So, they calculated the PESI score here, but how do you know that there would be good inter-rater reliability? If that's really a key value for your study, you should be thinking about convincing the reviewers that that was properly done. All right, data analysis. These common mistakes are pretty straightforward, but we see them again and again. So try to avoid them. One is no description of data analysis. Obviously, that's going to get you a 0 on the scoring that Nick presented earlier. Likewise, we see a lot of studies where there's a p-value listed for literally every single possible comparison that can be made using the data. It gets overwhelming and it distracts from the data analysis that's really relevant to your outcomes or your conclusions. So what we suggest to get you a good score is limit your data analysis to those outcomes or variables that are most relevant to your objective and your conclusions. And then describe not only the statistical significance, but the effect size and what statistical analysis you did. If anyone has a question, and Nick mentioned this in terms of confidence intervals, et cetera, if anyone has a question about what the difference is between just reporting statistical significance and effect size, I refer you to this really short, it's a single paragraph from Annals of Emergency Medicine that covers that and does a really good job. Links to the consort guidelines as well. All right. Pitfalls for conclusions. Nick already mentioned this. Don't overstate your conclusions. It seems obvious. And again, this one's near and dear to my heart. As a basic scientist, oftentimes you feel like, well, my work isn't going to change practice tomorrow. So how do I make it sound grandiose, right? You want to avoid that. Stick to what you found. Stick to the conclusions that you've got. And I want to just re-highlight the fact that we've redone the generalizability and innovation criteria to cover multiple study designs. So those of you doing surveys or medical education research or basic science, don't feel like you're going to be judged against the multi-center clinical trials that are being presented at the meeting. All right, writing, this one's a gimme, okay? Don't misspell POCUS in your abstract, right? Don't have a major typo. Don't have obvious grammatical errors. And this gets to a larger point, which Nick already made, but I'm going to repeat because it's so important. Start preparing earlier, and that will give you time to have people proofread your abstract, okay? If you start on January 3rd, you can't ask anybody to read your abstract. Most importantly, your mentors, right? The abstracts require a recursive process of review and criticism, good abstracts. So give yourself the time to do that. Also, there's a document, it's on the same website that Nick showed earlier where the rubric is, called Properly Formatted Abstracts. Read that and make sure your abstract is properly formatted. And then we've created a document called Tips for High Impact SAM Abstract Submissions. That's another very quick read. It's about a page and a half. It gives you some excellent tips. I didn't see that on the SAM website, so we'll make sure we'll make it available to anybody that wants it, anyone that's watching this webinar. Just a few simple ones. If you have a high impact piece of research, try not to break it up into multiple abstracts, okay? You could take a really good piece of research, and if you divide it into 5 pieces, none of those abstracts may get accepted to SAM. Instead, we highly encourage you to keep them together and tell a good story, like Nick mentioned. And of course, I've already said this, but it bears repeating one more time. Give yourself enough time to get feedback from peers and do multiple rounds of revision, especially with your mentors. And that is really all that I have. Nick, I don't know if you have any additional tips that you want to cover, or.
Yeah, thanks, Colin. That was great. I think that was a really helpful summary of the things that we're looking for from the perspective of the program committee, but I think that more broadly in emergency medicine constitutes high quality research. So we have some time if anybody has some questions that they'd like to ask. You can also, if you'd prefer, put it in the chat.
We have one person on camera. Are you planning on asking a question?
No, I just didn't want you to look at a blank group.
We appreciate that.
I'm here.
Yes, absolutely. Thank you.
All right, if there aren't any questions, we'll post this video online for your review later, but please feel free to reach out to either Colin or I if you have questions. We'd be happy to chat with you about specific issues that you're running into in preparation for your abstract submission to SAM 2022.
All right, we're looking forward to a great meeting. Thanks again.
Thanks, everybody.